So yeah, a little background. I'm a cardiovascular physiologist and a social epidemiologist. So I tend to look at biological mechanisms of how psychosocial factors may influence health. So I have a history of looking at things like adverse childhood experiences, exposure to abuse and neglect, for example, or socioeconomic circumstances across the life course, or social integration. And then over the last 7 years or so, I've been focusing quite a bit on mindfulness, both in observational studies as well as randomized controlled trials. And so this is one of our clinical trials where the data are just coming in. We're in the field right now. We're just about to finish the 1-year follow-up. And so these are people that have gone through a customized mindfulness intervention where they're trained up in things like attention control and self-awareness and emotion regulation. We're kind of seeing if we can enhance their abilities to self-regulate, basically. And then we take those skills and start to apply them to their relationship with the things that we know influence blood pressure. So their relationship with their diet, with physical activity, with alcohol consumption, with stress, even with antihypertensive medication use. And so we're seeing if we can kind of bridge those mindfulness skills to apply them to the things that we know influence this particular patient population. And so these are the results that we're getting so far, where we can see those with the highest level of blood pressure. These are the people with uncontrolled hypertension, so blood pressure over 140/90, that it's coming down a lot after 3 months. And as with most behavioral interventions, they have this kind of like check mark where it's come up, but there's still about a 13 or 14 millimeter drop in blood pressure after 6 months of follow-up. And then those with pre-hypertension or controlled hypertension are staying pretty stable. And so this is sort of an example of some of the research that we're doing so far. We have 2 other customized interventions going on. One is called Mindfulness-Based College. So it's a customized intervention in emerging adults, particularly the college undergraduate population. And so we've got a randomized controlled trial going on in it. And with it, we're finding that over the course of the term, those in the waitlist control group, their depressive symptoms are going up significantly. The sleep duration is going down significantly over the term. It's sort of like at the beginning of the term, stress isn't too high, and as it starts to build over time. And so we're taking the follow-up assessments when final exams are about to happen and all the term papers are due. And then also alcohol consumption is going up in the control group over the term. And so those going through the mindfulness intervention, it's almost providing this resilience where depressive symptoms are staying stable. And significant differences between groups, that the sleep levels are staying stable over the term, and also significant differences between the group. And also the alcohol consumption is actually coming down significantly in the intervention group. And so that's sort of examples of the work that I do, where we take mindfulness interventions and we customize them to the particular groups that we're engaging with to see if we can boost the effects even more when we're able to take those skills around self-awareness and be able to place our mind where we want to place it. And can we place our mind on our relationship with just how we feel when we eat chocolate chip cookies, or how we feel when we go for some physical activity, or how we feel, the pleasure that we get from, drinking a whole bunch on a Friday night, but also really being there for Saturday morning when we're hungover, and being there sort of in a non-judgmental, curious, accepting way, and just seeing if some insights kind of arise around the impacts of, the way that we live on our health. So those are some examples of some of the things that we're doing in terms of student opportunities. So if you're, welcome Courtney, if you're interested in really getting a first-person feel for what the interventions are about, we offer internships every time we do a cycle. So Julie Webb is an intern for us right now with the mindfulness-based blood pressure reduction study. So if you want to get a feel for it, you can volunteer with the study and help with the participants. Then you actually go through the mindfulness intervention itself. And then there's potential for thesis projects on impacts of mindfulness on physical health, mental health, and also the mechanisms as well. So we have too many systematic reviews going on right now, but we have about 7 that are underway through a major NIH grant on the mechanisms of mindfulness and self-regulation. And then as the data is coming in on these studies, there's opportunities for data analyses as well. So that's an overview of some of the work that's particularly relevant that I'm focused on these days. So yeah, I can